All right, now turning to Health Smart. The Food and Drug Administration has proposed a historic plan to reduce the amount of nicotine in cigarettes, as well as restrict the flavors in tobacco products.
To help us learn more about these plans is Dr. Nicholas Testa. He's the Chief Physician Executive, Dignity Health, Southern California. Good afternoon. How you doing?
Good to see you.
Thanks for having me.
So we were saying, I was fascinated the fact that they can regulate this. And you said that something happened in 2009 that started it.
Yeah, in 2009, the Family Smoking Prevention Act was passed, which really empowered the FDA to really control the tobacco industry more. So that's what we're seeing now is actually some research coming to fruition to say this is what they're going to do next.
So what are the levels that they want to, I guess, lower them to?
So right now a cigarette has about 10 milligrams of nicotine in it. Where they're going to is about 0.5 milligrams.
Wow,
so about a 95% decrease in the amount of nicotine in a cigarette.
And would a smoker recognize that amount of drop in nicotine?
That's interesting. So you'd think that a smoker would react very negatively, would immediately go through withdrawal. Several double-blind studies have shown that cigarettes that have the very low nicotine haven't really induced those withdrawal symptoms as was expected. So they've tolerated it very well.
And a lot of times, you know, we see children starting young smoking, and now there are these other ways that they can start to smoke as well. They're trying to change the flavorings.
Right.
Because in a way, it sort of could be targeting them with like cotton candy flavors, vanilla flavor.
Yeah, I think
they can affect that.
I think it's safe to say that's not, in a way, it is targeting the young population. And if you look at smoking and when people start, 90% of smokers start as children.
Oh.
So the cigarette industry knows that, and that's where they market to. Right now, really, by taking away not only the amount of nicotine, but also the flavored cigarettes really prevents that from happening.
Do you think this is something that eventually, like, people are going to stop smoking and realize, like, oh, I mean, maybe in 20 years?
So it's interesting. If you look at how many people are smoking right now in the U.S., 38 million smokers.
Wow.
Okay, 38 million smokers. That's 15% of the population. The modeling, which is really complicated for this, projects that there would be a decrease of 5 million smokers in the first year. If you look at smoking deaths, 480,000 smoking deaths per year in the United States. If you look at this over the span of the next decade, we could look at a decrease of 8 to 10 million deaths just from smoking.
Well, I mean, if you think about like in the 60s and the 70s, you could smoke on planes, you could smoke in your home, people smoked.
Smoke in the news studio.
You could smoke on the set.
You could smoke in the hospital.
Right. Are you serious?
Yeah, you could walk around the hospital with a cigarette.
Wow.
Yeah.
So it's fascinating to see those numbers dwindle down to 15%. So that's sort of the, you know, I live from a place of hope, but like that maybe eventually it just dwindles down to 2%.
We have seen a very conscious movement towards decreasing smoking, and it's really made an impact. This next step, you know, we're talking about 15% now, could get it down to 1 to 2%. That's what the projection is if this works.
Now, you don't work for the tobacco companies, but when you hear about less nicotine being in a cigarette stick, we've done stories about the fact that cigarettes are $10 a pack now in California because of the taxes. Do you think there's going to be a price reduction with less nicotine? Probably not, right?
Great question. So we don't know. One of the things that has been suggested as they roll this out is to say, okay, we could have both brands out there. We could have the one that has the very low nicotine and the regular nicotine. We're just going to tax the one with the regular nicotine much higher. So you introduce a financial penalty to going towards the higher one. That's been speculated. I mean, how they're going to actually do this, we're not 100% sure.
And it's still in a 90-day comment period.
Right. So what's out there right now is this advance notice, where it's the opportunity for people to give feedback and thought on the research that's driving the movement.
Nicholas Testa, thank you.
Thank you so much for having me.
Yeah.
Good for having you, man. Thank you.
Thank you. All right.